What is a pelvic floor? Do you have one? What does it do? And how do you know if it's not working properly? You may have been hearing this pelvic floor therapy buzzword, and how do you know if you need therapy for something that you don't even know what it is? So let's talk about what a pelvic floor is. In animals, the pelvic floor muscle is the tail wagging muscle. So you can begin to think of where your pelvic floor muscles are connected, which at least on one side is your tailbone. So walking on two legs, the effects of gravity on the spine and the muscles and the joints, childbirth, things like that affect the pelvic floor muscles differently in us than they do in, say, dogs. So if you walk away with anything today, I hope that it is an understanding that what we're talking about are muscles. Your pelvic floor are a sling of muscles. Some will call it a hammock that slings from the pubic bone in the front of your lower belly to your tailbone in your lower back, and on the right and the left connected to your butt bones. So you are essentially sitting on them right now. And while it is uncomfortable to talk about this, we all have a pelvic floor, male and female. We all need to function. We need the functions of the pelvic floor muscles, all of the different ones that we'll talk about today. And we need to be able to talk about it without stigma. When we take the skin and the hair out of the area where the genitals are, we will see that they are muscles. So this picture is female. The male really is pretty much the same. The muscles have 5 different functions, and they are essential for your high quality of life and overall function. So here we're looking at male and female from the side. So this helps us understand why posture is important. We're looking at that sling again. So at the very bottom, we're just looking at a thin layer. Those are your pelvic floor muscles that sling around the urethra, at the pubic bone in the front of your body, around the vagina in a female, and around the rectum in a male and female by the tailbone. And if you look above, you'll see the organs. They are all fascially connected to each other, the bones and the muscles, and then as well as to the sacrum and the lower spine at the top. The nerves that innervate everything, the organs and the muscles below, come from the top. So that's where back pain and hip pain, intestinal functions such as your gut health, constipation, even stress and anxiety can affect these muscles. So because your pelvic floor is part of your deep core, it is part of a system that is required in every aspect of life. The pelvic floor muscles are essential for bowel, bladder, and sexual function. So peeing, pooping, and having sex. But they are also part of your everyday life, pushing, pulling, running, squatting, balancing. Therefore, when we're looking at rehabilitating your core, whether it's pain or weakness or lack of balance, your pelvic floor needs to be considered as part of the issue. The only way to change anything is to become aware of it. So understanding what your pelvic floor muscles are and what is normal for you is the only way to truly be able to change and control when things get out of hand, when your quality of life gets affected. Understanding your normal now will help you communicate with your medical team later. So bladder, is it easy to go? Is it easy to keep it in? Leakage is never normal. Bowel, same thing. Is it easy to go and easy to keep it in? Urgency of bowel and bladder can seriously affect your quality of life, such as standing in line to shop and having to run to the bathroom. Sexual function should never hurt. And is it easy and enjoyable? Does it allow for spontaneity? And then movement. Pain-free, comfortable, again, shouldn't affect your quality of life. It shouldn't stop you from doing things because you have fear of pain or re-injury, or that you have to plan your life around any of those things, such as pain with intercourse, bowel or bladder function. So believe it or not, that small area that you're sitting on has 5 jobs throughout the day. So we learn it as the 5 S's. Stabilizing, supporting your posture, supporting your organs, sphinctering off urine, sexual function, and last but not least, a sub-pump, lymphatic function. So let's explore what all of those 5 functions look like in your life. If your pelvis is the foundation to your house, then your pelvic floor, that truly is the floor that stops everything from above it falling out and balances everything below it, then this is truly an imperative function of your pelvic floor, stabilizing your pelvis, stabilizing your posture, your diaphragm above, your pelvic floor below, and then your low belly and your low back in the front and the back creates this 360 degrees or a 4-dimensional container that your pelvic floor has to manage. And everything from quick sudden movements, jumping, balancing, rolling over in bed, sit to stand from bed and from the toilet, require your pelvic floor to function properly. So your pelvic floor muscles sling around the urethra to sphincter off urine and around the rectum to sphincter off stool. Leakage is never normal. Pain is never normal. Difficulty getting it out is not normal either. These are all signs that the function of this muscle, sphinctering, is not working properly, and therefore it's not something that will get better on its own. Awareness of your normal now to communicate that maybe the muscles of your pelvic floor are in jeopardy of becoming weaker and less functional. I'd just like to interject that no leakage is never normal. It is a symptom of another problem. Things such as it's because I gave birth or because I'm old are not legitimate excuses. Your pelvic floor muscle is not functioning properly. Therefore, your body is telling you via symptoms such as leakage. So take control of it now. So if you think of the pelvic floor muscles like a sling from the front of the pelvis to the back, it ultimately helps support, like a hammock. The hammock supports your organs, your bladder, your uterus, cervix, and rectum. And so prolapse or pelvic organ prolapse, such as a dropped bladder, which would be a cystocele, a urethrocoele, a rectocoele, can all occur when the pelvic floor muscles are no longer supporting well. So remember when we talked about one of the functions being able to support and stabilize your posture. If muscles are weak, such as our gluteus maximus, if your butt muscle is weak, then your pelvic floor might have to work harder. If it has to work harder to stabilize your posture, it may not be able to work as well in the other functions, such as supporting your organs or sphinctering off urine. So looking at the deep intrinsic core muscles, how they function, and then teaching you basic things such as how to coordinate the diaphragm and the pelvic floor in activities such as how you get in and out of bed can make all of the difference in retraining these muscles, which is absolutely possible. So there's actually 3 layers to your pelvic floor. And the first, more external layer is more for sexual function. So blood flow to the organs, the clitoris and the penis are super important, obviously, for this function. So when there's a lot of tension around this area, it can affect blood flow. When there is scar tissue or even fear of pain from a repeated history of having pain here for whatever reason, your brain now can associate intimacy with pain or discomfort, and that can affect the tension of the pelvic floor, right? Like when you have fear, your muscles might tension up more, and that can affect sexual function as well, which then if you start using the muscles less, then that can start you down another path. So sexual function and pelvic health go hand in hand. So the pelvic floor's ability to act like a sub-pump, super important, especially for anybody who's had lymphatic issues, such as lymphedema that may be associated with radiation and chemo, and also just the damage that can occur from radiation and chemo seriously can affect this area. But there can be other reasons to affect the sub pump, such as scarring and childbirth and obesity, weight gain, weight loss, and movement issues. Because motion is lotion, the lack of activity in either the genitalia, the hips, the back, or the overall body can affect the health of the sub pump function of the pelvic floor. So now we look at the body as a whole, from the throat all the way down to the floor. Tension above can create tension below. Weakness on the outside can create weakness on the inside. The fascia, how everything is connected, the organs, the muscles, the joints, can truly affect everything. So we are looking at coordination as more important than strength. The coordination of the diaphragm and the pelvic floor, the coordination of the diaphragm with your spine and your hips as you move. All of that affects how pressure moves in your system. And that is ultimately what can make or break keeping your fluids in or out, or getting them moving as intended based on your goals and your symptoms. So because your pelvic floor is so deeply connected with intimacy and emotions, your pelvic floor can be affected by fear, which we talked about earlier. It can be affected by all of your emotions, as well as your organs. So a intestine or a bladder that is not functioning as well, or has history of not functioning well, can also give your pelvic floor a history of dysfunction. But it doesn't mean that they all can't be improved, because they're muscles. Last but not least, remember that we're talking about muscles, and muscles can all be re-educated. So these are all the different risk factors that can increase our risk of having a pelvic floor muscle dysfunction. So if you have dealt with any of these or are dealing with any of these, it could help kind of give you an understanding as to why you might be watching a video about pelvic floor health. But just because you've had one or all of these does not mean that the muscles cannot still be re-educated. They only need the opportunity to learn. So pelvic floor therapy evaluates the health and function of your pelvic floor. But then we also will talk about how many times a day should you pee, drinking enough water, kegling, all of the habits and behaviors that go along with re-educating these muscles. If you still want to learn more specific to your symptoms, feel free to give us a call and set up a free consult, whether it is in the clinic or we can do it virtually as well. You will talk one-on-one with a licensed therapist to help better understand how we specifically can help you change your life based on your symptoms and your goals today. So expecting to be heard and seeing results does not stop on day one or once you graduate from therapy. We want you to continue to feel supported and have the resources you need to maintain lifelong success. So whether you're coming to therapy in the clinic or you need to stay safe and stay at home, you can do virtual visits through your smartphone or laptop. We are also constantly providing you tips and tricks to maintain your progress, whether it is emailing our newsletter, looking at all of our content on Facebook, Instagram, and YouTube, and then also taking a look at my book, Your Self-Care Matrix, to allow you lifelong success so that no matter what life throws at you, you have the tools that you need. Bravo, great job. Thank you so much for taking the time to learn how to help yourself today. Thank you for spending this time with me. We look forward to working with you.